Hello and welcome to SimCast, the higher education simulation podcast. My name's Lawrence Hill and I'm joined by my regular co-host, Tony Jermy.
Hello, welcome back to SimCast. Glad to have you with us.
So in today's episode, we are going to be talking about co-designing AI scenarios for virtual placements and really focusing on representation in simulation. And we are joined by two fantastic guests in Abby Mitchell and Benham Jafari Salim. Hey guys, thanks for joining us.
Hi, thanks for having us.
So just to give you a bit of background on these two guests that we have, Abby is a simulation education lead at King's College London, where she has designed and scaled a bespoke community simulation-based virtual placement that blends AI patients, live actors, 360 scenarios and structured debriefing. Benham is a digital learning specialist at King's, previously worked as a learning designer and simulation technologist at the University of West London, and has a background in the creative industries and studied music at London College of Music, and has worked in immersive technologies from the start of the pandemic when he began working with Abby at King's.
Take a breath.
Yes, thank you very much. All in one breath. Welcome to you both. It's so nice to have you here, and we're really excited about digging into this episode with you.
If you enjoyed the episode, please give us a like. Equally so, if you didn't like the episode, give us a dislike, but let us know in the comments why, because we're always keen to improve. To keep up to date with all things Sim, subscribe to the channel and don't forget to check the notification bell. And SimCast is available on all popular streaming platforms. Let's dive straight in, shall we?
Yeah. So before we get into kind of why representation matters in simulation, and that is a really important topic, would just love to know a little bit about why you guys do what you do. So, Abby,
who wants to take this one first?
Abby or Benham, whichever one of you wants to take it first. Why do you do what you do? Why do you do this?
Yeah, so thanks very much for having us, and great question. So what we wanted to do was look at the current curriculum, the provision that we were delivering in terms of simulation, and think about how we could make that more accessible for our students. We are in a post-digital era, we're in the fourth industrial revolution, and we want to mirror that in the curriculum so that it's contemporary, so we're delivering learning opportunities that people can access not only in the university campuses, but from anywhere and from different platforms. We know that our students are digital native, they're very good at utilising technology, and we wanted also to reflect what's currently happening with the NHS plan and the move towards technology and how we could enhance that and get our students ready for technology when they have their first placement.
Okay. So there's a real, for you, the kind of the why behind why you do this is about the kind of evolution of education as much as it is about the topics that you talk about in Sim. Thank you so much. That's really interesting. Benham, what about you? Why do you do this? Why are you working at King's as an educational technologist in simulation?
Lawrence, I think that that's a wonderful question. If I go a few steps back, when you kindly mentioned about the background, in the creative industry, and very interestingly at that point, I was working about a project which was around use of immersive technologies on boosting interactions between communities and classical music, and actually. Then I realized, the effect that digital technology and all these tools that we have available in terms of improving the interactions and engagement. It was a very, very, very interesting point. And actually, after that, I realized what I really enjoy the most is making impact and improving things for others. And in many ways, I found simulation. Like arts, you kind of, work for, around different projects, you kind of, rehearse, there are a lot of collaborations. And once you put it together and, put it out there for learners and, subject matter experts and, wait to see, if it has addressed, the learning outcomes, whether it has, addressed, what we're trying to achieve. So I feel very privileged, to be in a position that work with colleagues like Abby or other subject matter experts.
But you know what? Here's the thing, Benham. For me, I think actually it's us.
It's the
healthcare educators who are probably really. We were talking about this, weren't we, briefly before we started the recording. That actually, I appear to be seeing anecdotally, what we're seeing is an increase in the team members, the faculty members with a background in arts and humanities, kind of feeding into that narrative about simulation. And I reflect on, Sharon Weldon's talk at HPSM when she talked about the comic book of simulation, about how we choose how we represent reality. And actually, who better to be thinking about how we reflect and represent reality than people that are schooled in the arts, right?
Yeah, and also we were talking briefly off camera with Abby about how, I asked Abby how kind of technologically sound were you before you started this project, and you said you feel really comfortable when Benham's with you. I think we're in such an exciting time where Lawrence and I are firm believers that simulation is still a technique, not a technology, going back to Gabba's definition back in the early 2000s. But when we started, the technology was literally like a physical patient simulation mannequin that was kept in a room and used now and again. But there's so much now that technology can afford in terms of our simulation offering. But again, there's that barrier for a lot of simulationists of, I'm technologically naive, or there are certain aspects that I could probably do some aspects but not others. So marrying that up and working with other industries and other sectors and other disciplines is really, really important.
I think that's a good point. Sorry.
Go on, Abby.
I think that's a good point. And we found, since Benham and I have been sort of talking to other groups and really being invited to other platforms such as yourself, that more and more learning designers are being employed in these type of roles, which is very exciting. And they want to kind of pull that community together and maybe learn and share experiences and have shared platforms for some of the things that are developed, so we're not all reinventing the wheel. So we can definitely see a change and a shift in these kind of roles and what these roles are contributing to simulation, which is fantastic.
And importantly, how you've been using technology, and we'll come to the project that you've been doing. You've used technology to help identify and solve a problem rather than being led by the technology and just trying to shoehorn it into simulation. So talk to us a little bit about the problem that you were facing and then how you use technology to solve that.
Yeah, and I think you're right. That was the key. So we identified the problem was that we're a very busy London university. We wanted to give our students learning opportunities that were representative of the London population, the London community, and what they would experience out in practice. Maybe experiences that they would have so that they could, as Benham rightly says, rehearse and try that out before they went to practice, or experiences that you wouldn't get in practice due to capacity issues or lack of resources or staff shortages. So we identified that gap, and then we looked around to see what digital tools and expertise we had in place already that we could put together to design something that would fit that gap. And I think that's what worked really well with the virtual placement that we designed and Benham has built, in the fact it's a collaborative entity. It isn't just beholden on one modality. It gives students opportunities to utilise their clinical reasoning skills, their decision-making skills, but also their documentation skills, their non-verbal communication skills. So it has those kind of elements to it all in one ecosystem, which was really important to us to make it a sustainable piece of work that students could work with from years 1, 2, and 3, grow with, and that we could change depending on what was happening in the current landscape of the NHS or within population health.
When you talk about, it sounds like an obvious question, but when you talk about representation of the population of London, what do you mean by that? What representation did you need?
Yeah. London's beautiful. It's a beautiful city full of fantastic population. And in that, we have everything. We have every aspect of population health, which is why it's such a great place to learn and study to be a nurse or any other healthcare professional, because if you couldn't do it in London, you can do it anywhere. But we know that there are placement capacity issues. So just because we're this fantastic, great population doesn't mean to say it's accessible, or even that the population's voice is heard and represented appropriately. And that was really important to us. That authenticity of the virtual placement is what's made that learning experience a much deeper experience for our students, and also made it more transferable for them when they then go back into clinical practice.
You were when we spoke previously. There's some kind of specific population groups that you felt that you really wanted to sort of centre, and particularly sort of learning disability, transgender, and racially minoritized partners. Like, can you talk to us about how you kind of engaged and ensured that the scenarios that you wanted to, the simulations you wanted to create, felt authentic and real and not kind of stereotypical or, in some other way pejorative?
Yeah, absolutely. This is really essential to us, and this is the work that we continue to do. We're still building on these principles that we've set out for ourselves. So we've reached out to these minority groups, and we have invited them to partake in workshops to help us to co-design, and that's essential, that co-design element. So with the learning disability groups, we've been to 2 different learning disability theatre companies. We've co-designed scenarios. We've talked about what health looks like from their perspective, what could make things better, what makes things worse, and we really have worked really hard to capture that voice and not only internalise that within a simulation scenario, but also thinking about what happens beyond that simulation scenario, so that it is a continuous learning journey and it isn't just an isolation. We then have invited those actors to play those roles. So we were very lucky that over 15 actors with learning disabilities came to King's, and they took part in our virtual placement, which was a wonderful experience for us and for the students. We have since then run workshops with the homeless community, with a Cardboard Citizens Theatre Company, and we are planning to remodel that. And we have a very exciting project coming up with the prison service in the next few weeks, where we will be doing a similar scenario and capturing those voices.
It's really interesting for me, right? So we're currently situated in Norfolk, in Norwich, in Norfolk, which is not renowned for its diversity, right? So like obviously it's diverse, like any kind of large city is diverse, but I guess
not in the same,
but not like South London, and I guess I suppose intuitively I'm thinking, it seems interesting that considering your students are naturally going to be engaging with this multiplicity of groups and of individuals, it's really interesting for me that it's despite that practice exposure in clinical practice that your students are going to get, this has felt like a priority to also bring into the simulated learning environment. Whereas you might feel that students are more, rural, let's say, universities might perhaps have even a greater need for some of this than perhaps some of your kind of more central students.
I don't know if I necessarily agree with that. I think it's difficult. It's on that taxonomy, isn't it, of where this fits in terms of the development and support. Now, Abby, I think when we first met, and this feels like a long, long time ago when we had that first initial meeting, I remember you saying something along the lines of doing it face-to-face is different from doing it with a AI simulated patient, because the learners can build the confidence in that AI environment. And we might be jumping a few steps ahead here, but I think it's part of that whole taxonomy of where that simulated placement fits in.
Yeah, absolutely. And from taking your point, Lawrence, as well, our students want to get it right. When they are faced in these situations, they want to do a good job. And we talk about that a lot with them in expectations and preparation, and how we can make sure that they feel that they have the tools and the skills to do that. So one of the things that our students talk to us about, and we openly engage with fluid feedback and evaluation from our simulations, is that we might do a trans scenario, which we did in the simulation, but it's a difficult conversation. And having those difficult conversations, especially in a simulated environment, when you know in clinical practice that might look slightly different, puts them on edge, makes them feel a little bit more uncomfortable, maybe triggers some other emotions and experiences that they may have. And so to address that, what we did was we have worked with the student to build a pansexual scenario, and we built that in AI. And that was very much came from the feedback of the session, that I want to, when I come into the session, I want to do a good job, I want to do it right, and I want my patient to walk away feeling like they've been heard and listened to, and I am able and competent to meet their needs. And so we've used AI really well in that kind of preparatory phase of how do I have those difficult conversations. Another one that we use that's really good is men who have sex with men. And we then bring them into simulation or in the virtual placement to have those live conversations. But we also use the AI again on the other side. So thinking about, okay, well, I've had that conversation now. So what does the follow-up look like? Who do I need to speak to? Is it another member of the multidisciplinary team, or do I need to refer? Or do I actually need to go back and speak to this patient again because the information I've got, I've now found out that we need to do an intervention or a treatment. So we use it as very much hybrid to kind of support the simulation and to give extra authenticity and credence to the work that the students are doing.
How does it? How do you integrate these topics within the curriculum? Are you doing kind of foundation, basic skill acquisition first, and then adding layers of complexity in these different service user groups, patient groups, as you go through years 2 and 3, for example?
Yeah, absolutely. Our whole curriculum is scaffolded. So we use that approach for all of the learning activities that our students do. And thinking about the virtual placement as an example, the first year virtual placement, what we really wanted the students to take away from that, the key learning points, was understanding their role within the context of the community and the scope of practice, but also the other roles within the community and how they work together, and the importance of that in primary care and the integration between primary and secondary care. When they came into the virtual placement for the second year, that's when we really wanted that representation, those voices, those complex scenarios. So we know now where we fit within this situation, but now what do we do? What is our role, and how do we expand on that? And how do we learn and develop and hone those new skills?
Great. And again, so this came initially out of necessity because of the COVID-19 pandemic. Is that correct?
So we didn't build the virtual placement out of the COVID-19 pandemic. We started to utilise digital tools though, like virtual reality. That was our first digital tool that Benham and I worked on together. And that was out of the COVID-19 pandemic, when we recognised that we needed to use different modalities for simulation. We also needed to work smarter and not harder. And we also needed to look at the resources we had and think about how we deliver different types of simulation in different places at different times, synchronously and asynchronously.
Okay. So how do you bring in Benham to this then? Where at what point do you go, okay, well, we've got this project, we need to then maybe look at a new method of delivery, or working or making it more complex and adding layers onto it? How do you two work together to achieve your goals?
Benham's the most important part of every project. There is no doubt about that. I will tell you from my perspective, and then I would love to hear from Benham's perspective about that as well. For me, it's about identifying that gap, thinking about the simulation pedagogy, thinking about where we are now, what we need to be, and taking on board the feedback and evaluation from the students, from our clinical teachers, from our academics, and from our practice partners. And then going to Benham with maybe a suggestion or idea, and Benham makes that happen.
How do you make it happen, Benham?
Well, I mean, if that's okay, let's agree to disagree on that, Abby. But that's a very good question. Sometimes, when it comes to my role, there are a few things. I mean, it spans from, from a learning design perspective, and then digital pedagogy and implementation. So there are it's quite a back and forth, progress between, technologists and, subject matter experts. So, the way I see it is, and Abby knows I always say, like, I'm very, privileged that we built this relationship, but, we always know that, okay, certain needs to be addressed, and, then, we come up with some, ideas and solutions, and, Abby as our lead to kind of, she's, the person who kind of oversees, whether we're in the right direction, etc. And, my role is, to go back, see, the infrastructure that we have, what is available, and, to kind of see within all these, issues that we're facing, but also internal, technical, needs that we have, but also, what King's or, other institute dictates for us, how to make it happen. So it's quite a,
it's a very involved process.
So normally a university will have its own internal systems, which it's probably had long-standing kind of relationships with those companies that provide them. And then for simulation, we'll often go, oh, there's this new bit of tech or this new company that's come on board, this new software solution, and we have to try and integrate them. So that can be a challenge in itself. Benham, how does it feel not being a subject specialist in this area? Is it kind of a help or a hindrance? Can you come in with a fresh pair of eyes and look at some of these solutions? Because I'm assuming with something as sensitive as some of the patient groups that we're potentially dealing with here, getting it right is really important.
Sure. That's an excellent question. I mean, I cannot give you too much detail, but an example of it, happens with Abby actually yesterday. So it's like, you come up with something, but then, at the end of the day, I'm not subject matter expert. In some ways, it removes the pressure. But I think building that, relationship between, subject matter expert and, technologists is crucial here. Because after some time, you build, that trust, you understand, oh, you know what, certain things, you can kind of, make suggestions. And then, at the end of the day, decision making is with subject matter experts. So in some ways it reduces the pressure, but as I said, we have kind of worked together for a few years now, and I understand a little bit better the vision that Abby has. Sometimes it takes me sometimes because she's always 10 steps ahead of everyone else, but this is part of the working relationship that we've built, and I'm very, very privileged to have her leadership and support as well, because
and it's just it's so interesting as well, because they are quite discrete disciplines, aren't they? Like kind of health and health kind of complex health matters, and then the technical expertise that you need to have in order to integrate different platforms. So, you're talking about virtual reality, you're talking about artificial intelligence, you're talking about a bespoke user interface. You said an ecosystem that you've had to create to embed this as a kind of a fully curated kind of learning experience and placement. So what are some of the technical challenges that you face in terms of the scale that you're operating at? Like, I think there's potentially hundreds, right? Am I right in thinking there's hundreds of students doing this virtual placement when it's happening per day? What challenges does that pose for you from a facilitation perspective and from a technical perspective? Abby.
Okay. I'll start with the most we've had in one day doing our virtual placement, about 280 students.
Okay.
So
Whoa.
From a facilitation point of view, what we want to think about is what needs and support do the students identify before we start the virtual placement. So we do a lot of onboarding with our students. Benham and I go and meet them. We talk to them about what's expected. We do walkthroughs and introductions. We do Benham and Abby's top 10 tips, pop up every now and again to see them. So it's all very much about kind of getting them ready and preparing them for this, because what we found in the beginning was that students found that very overwhelming. Although we have an interface, which is brilliant, and it's really easy to use, it's still a lot of different elements.
So you put a concerted effort into familiarising the learners with the simulated learning environment.
Yeah.
So like it sounds like an extended briefing essentially of what they're managing their expectations about the learning event.
Yeah, absolutely. We also have a very comprehensive training package. So the students have access to that training package before even we've gone and popped up into their different cohort leader times or whatever it is that we've gone to. And then we also, on the day that we launch the virtual placement for them, we have another induction. So that's really then to troubleshoot. And the troubleshooting, I'll let Benham talk to you about, because there's a lot of technical troubleshooting of that. But we try to identify what those technical issues are then and there. If somebody does have a particular learning need, we will work one-to-one alongside them. So I will do that and make sure I'm checking in, because that asynchronous learning can be overwhelming. We also take into account any neurodiversity. Students have asked us potentially to have their live appointments earlier in the day, because if it's later in the day, they spend the entire day worrying that they've got this live appointment. If I've done it and I've got it out of the way, then I can move on and think about the other things I need to do. So we take all that very seriously. And we also offer throughout the day, we offer a technical drop-in. So they can come in and talk to Benham, Dr. Benham with his technical drop-in. And we also are there on hand at any moment. So I'll often see pop up in the Teams chat, Benham going, right, I'm coming, I'm joining your call right now, as he's diving in and out to support the students.
Great. So a couple of questions for me. First one, does it, presumably this can attract and qualify for simulated practice learning?
Yeah.
Yep. Okay, great. So
practice learning hours,
yeah, one of the natural barriers is if you're using an external program for AI, there's a cost involved, but that cost can be offset against the SPL hours, which is great. Then coming to you, Benham. So what are some of the technical hurdles when you run these things live? What are you getting bombarded with technical issues, or is it because you've got a really slick system now, generally speaking, relatively smooth?
Thanks for that question. I mean, to be honest, the technical difficulties are part of,
your everyday language.
yeah. So, like for example, yesterday, we had a virtual placement which is for a module. We called it Cancer Clinic, and we do it. So, we still have those, day-to-day issues, especially if we are involving, service users and simulated patients, which, we work with them externally. And unfortunately, sometimes, probably, you have sent in your institution as well, if you have got external, colleagues involved, sometimes, the issues with teams, you were expecting, students to let them in, and, if the students miss that step, suddenly, we're getting a message from both student and simulated patient and say, oh, I'm waiting on the call, but there's no one there. So, those issues are, part of what we try to do, as Abby mentioned, is that, we deliver induction session early morning, and before that, we give an overview session into students for them to understand what to expect and what they should do. But still, those are part of it. Having said that, I would say our major issues were actually before delivering the first inaugural virtual placement, because it was something that had never been delivered in that format, and in terms of logistics and implementation, we were still trying to figure out. I mean, for the first inaugural one, we delivered around 1,500 one-to-one live simulation interactions between students, and so in kind of scheduling and delivering those sessions, we had to kind of, think it through. So I would say from a logistic point of view was, the biggest issue. But the other thing is that I remember, we had a conversation with Abby about, how, what was her vision about, delivering this virtual placement. And then at the end of the day, we had to make, compromise to our internal, policies as well. So, how to kind of deliver on those key elements while, you are aligning with internal policies. I would say, that was the big issue. We wanted to kind of, develop a, electronic health record system in a different format, but then, our IT leadership, they say, it has to be, this way.
Yeah,
this way.
we've encountered the same sort of issues before. Having someone on the IT side of things who can fight your corner with those kind of things is invaluable. I'm sure, and Abby's nodding her head, so I guess she's experienced the same thing.
And then I imagine there's loads of stuff. Go on. Yes, go on, Ben. I'm sorry.
No, what I just wanted to say as, some issue that I was expecting to happen but never happened, which was the most brilliant thing about this was, resistance to, to adopting, this new format. I mean, we have had a, fantastic, support, from our, academic colleagues, and, it goes all to, Abby's great work on that, to kind of get the faculty to buy into delivering this. That was something that, we're expecting to happen, but, thank God.
Well, do you know what? For me, the numbers speak for themselves, right? In what other ways, apart from a really sort of stale, boring lecture, can you capture 280 learners in one session and go the other end of the spectrum and be really interactive? You just can't do that in conventional sim, can you? So
just to sort of paint a picture then for the listener. So at the beginning of this sort of virtual placement, there's some live clinics, there's some kind of pre-recorded kind of virtual reality engagement stuff, there's some AI kind of consultation that takes place, and I dare say some other activities as well. What is the role of the facilitator over the course of the day? What kind of part way or end of day debriefing takes place, and what format does that take?
Yeah, so we built the virtual placement to align with the SSSA standards. That was really important to us. So the supervision, the long arm supervision.
Sorry, just to say, the SSSA standards, for anyone who's listening who's not quite sure, are the Nursing and Midwifery Council standards that have to be in place for a practice learning experience to count as a practice learning experience, basically, right? So, sorry, carry on.
Yes, thank you, Lawrence, for defining that for me. Yes, so we had long arm supervision, which students, when they're working asynchronously, so there was opportunities for them to engage with a facilitator, which we called a practice assessor or practice supervisor to fit within the structure of placement. So during the day, there is long arm supervision. There is real-time feedback from the use of the AI, which the students find really valuable, but also they can then interpret that feedback and have another go. So making sure that learning continues with that modality. We have live patients, so they give feedback on their interaction. And we also do joint visits. So the students will have their practice assessor, practice supervisor come up into that call and do a joint visit and give real-time feedback for that. Then at the end of the day, they have a supervision debrief, and that's done in groups of about 10, where it's very much about debriefing from, we use the plus delta model, very simple but very effective in terms of understanding what's gone well within the virtual placement, what's not gone so well, and what they would do differently. And because our virtual placement tends to run for 5 days, there's a real opportunity then to kind of continue that discussion throughout the days and to look at the learning and the development as they progress through it.
So 280 students, roughly 10 students per debrief. That's a minimum of 28 debriefing sessions. How do you staff that? How many people have you got working on this day?
Yeah, so we were really lucky with our staff at King's. We were really lucky in the beginning because it was a massive leap of faith when I said to everyone, come and do this. And they were like, well, what do I have to do? I said, I don't know yet because I haven't built it. So it was a massive leap of faith, and our staff brought into that wholeheartedly and gave us their time, which is very generous. They needed to give us time for that debrief, not for the whole day, because we run the day. It was that debrief time that we were looking for. And we resource that within the department. We also have some clinical staff that come as part of their clinical development. They've asked us, which is amazing, and we never say no, to coming and being part of the virtual placement, because what was happening was the students were talking about it when they were going out in practice. So they wanted to come and see what it was like, and then they help us out. We have some alumni students who have helped us as well and been part of that virtual placement experience. And we're also very lucky at King's, we have clinical teachers, and the clinical teachers are also part of it. So we have a large pool to draw from, but we by no way underestimate that we are asking more work and more from people, and we are incredibly appreciative of what they bring to that.
So I'm presuming there must be like a 2-hour window towards the end of the day where these debriefing events kind of crank up, and they're kind of hot and cold running debrief for learner groups. So for the majority of the day, it's probably the two of you fielding concerns for 280 students, and then come 3 o'clock, let's say, when the debrief starts. Breakout rooms. How many faculty do you then need to staff that? Like, what's the draw in terms of staffing resource required to facilitate that end of the day debrief?
Yeah, so we need so that question for me
in terms
again,
of number. How many staff do you need to cover those debriefs?
As many as possible.
So ideally, one staff member per session.
So what, like 28 staff, or so?
I mean, we will be flexible with the group size. I genuinely mean that. It goes out on the resource sheet as many as possible. So we will be flexible. I mean, obviously, if we don't have enough staff for whatever reason, we'll make the group sizes bigger. Or what we've done, or I've done in the past, is I've run debriefs back to back. So I've done a debrief, and then I've had another group of students in, and I've debriefed as well. We will make it work.
I absolutely. I think the point I'm kind of driving at is that I think that virtual placements and AI powered placements and VR has this sort of superficial, false allure of being less resource intensive. But actually, you have thrown a tremendous amount of resource into development, logistics, planning, and then delivery, and then this kind of like torrent of staff time which is required at the end of the day to ensure that these experiences are unpacked.
I'm sure you reframe it differently, don't you? And you give them the gift of the time for the bulk of the day, and then they just come into the
only need you for an hour at the end of the day.
We do, but also what we found, and you're right, it is, but
that's okay. That's the thing. I think simulation is so resource intensive, and I think it's so important that we acknowledge that actually, even innovative, novel, kind of technology enabled, kind of high quality simulation requires natural intelligence to do effective debriefing and takes resource.
Yeah, I completely agree. What I also think, and what I found in my role, is if the simulations are good, people want to be part of it. Simulation has a little bit of a Marmite effect.
Yeah.
People either love it or hate it. But if you can provide good quality simulations that are there for you to work with the students, to see their growth, to see their development, to be part of that journey with them, I find that staff want to partake in that, because that is really rewarding.
So the staff are keen to partake because they can see the benefit of it. Are there any challenges with when you're debriefing, doing it online? Is the engagement from the learners, do you have any cameras have to be on policy and that kind of thing?
So there are lots of challenges, as we all know, with debriefing, and also with simulation and passive observation. And this is where we've really tried to get rid of that in this, because you are working on your own, so you have much less opportunities to sit back and passively observe. Cameras have to be on, microphones have to be on, and you have to contribute. You cannot sit back in these discussions, because just turning up is not your attendance. Your attendance is linked to your engagement. And we are very strict with that. We do have an attendance policy that goes with the virtual placement, and we do manage that. And we also manage unprofessional behaviours. So if there are things that happen that perhaps shouldn't happen, like we've taken a video call in a public area where other people can hear the call, then we will deal with them, and we deal with them straight away, because we expect the professional values that you would carry out in placement are upheld for the virtual placement.
Excellent.
As well.
No, I love that.
Great. We haven't really touched on platforms that you use. So what different platforms and software have you had to use to make this a reality?
Benham, do you want to take this one?
Yeah, sure. That's a very good question. And it goes back, a little bit to the fact that we mentioned about the internal policies on what can we use and what we cannot use. So, to answer your question, we had to, integrate a few elements within a bespoke system that we developed, in the house. But the main portal for it's Microsoft Teams. So what we have done is we have embedded this hypothetical community center within Microsoft Teams, and then where students, they log in, they see they handovers, all the patient appointments, and the activities have been embedded within that electronic health record system. At some point when there was a governance and data issues from the Kings, what we had to do was we had to link the system, however, to answer your question, we have bespokely built this program, and all the live appointments, etc., is being done through Kings, but then all the links to individual appointment has already gone to students. So for all the students, they already would have it in their calendars, the appointment with the simulated patient. If it's a joint visit between the practice assessor, student, and simulated patient, that has already been sent in advance. But also, we have used a third-party AI platforms, which has supported us to deliver those AI-led simulation.
Yeah, I was going to ask this. So the AI is an external third-party platform rather than being developed in-house.
Oh yeah, so I was going to say we use SimConverse, which is the AI platform that we've been using. We have used them quite considerably in the last 3 years, and really kind of incrementally stepped up our usage. So in the beginning, we used it very much as a kind of adjunct to some simulations that we were running in particular modules and programs, but nothing consistently across the curriculum. And we have very much changed that approach, and there is a consistent embedding and use now across the programs, and it features highly in the virtual placement. One of the things when you asked about any technical issues that we found is if our students decide to do the virtual placement abroad, we have had some issues there with using the SimConverse platform. The company are excellent and very supportive. It's not to do with them, it's to do with being able to use that abroad, and that has caused us problems. We weren't expecting that when we first launched. That was a big shock to us. So we now have to say, please don't go abroad and do the virtual placement. Please stay in the UK and
fair enough.
The UK.
And we know the guys at SimConverse, and we know that their platform is always sort of developing and evolving as AI does. As a customer, did you bring any unique challenges to that platform in terms of what you were trying to achieve with your diversity of learner, sort of patient groups and things like that?
So we've worked with them quite considerably over the years, but what we did was we've started, or I say we in the royal sense because it's Benham that builds it. So Benham started to build our own scenarios within the platform.
Okay.
So where we utilised their library, which was very helpful in the beginning, we found that we could maybe make some tweaks to some of their library catalogue, and we could use them Now we're in a situation, because we co-design, that their library doesn't meet our needs, and we need to create our own scenarios and our own characters within that platform.
Great.
Amazing. Well, I mean, it strikes me that what you've done is you've sort of grown organically the kind of interaction with various different platforms, and you've reached a kind of critical point where you're like, we're going to have to build something of our own if this is going to really sing. So you've gone a very long way down a track, which is great to hear about. But if you were, talking to, program teams, who are just thinking about embedding some kind of technology like this to augment their simulation, what kind of one tip would you give those programs just starting out now?
I think my tip, and Benham's might be different, would be to make sure your academic staff are on board first. The success of these platforms, these innovations, these learning ideas are all bound by how good the facilitation is, how good the simulation is, and how people find that accessible to use.
Yeah.
So I will start with the staff. Once you've got people on board and they can see what you can see and they are willing to come along with you, that's half the battle. My other tip would then be to spend a lot of time onboarding the students. Do not underestimate the amount of work that is, because there's no point in spending all this money on something that your students don't like or they can't use and your staff don't want to use, because there's that fear.
Yeah.
So all of that must be done before you even do anything else, I think.
Yeah. It goes full circle back to what I was saying earlier. That historically, the sim man that never got used and sat in a cupboard was such an expensive purchase. Now it's headsets or licenses or tokens that, if you don't get it right with the people, it just becomes a very expensive investment, which doesn't get used.
Absolutely. How interesting that amidst this whole conversation about, integration of technology into learning, that actually fundamentally the success
This is the people
depends on the team and bringing the team in and bringing the learners in.
Benham, what about from a perhaps more technical side? What's your kind of key to success?
To be honest, that's perfect way of putting it together, because now just reflecting on this journey, at the end of the day, it's about how these different stakeholders are working together. Subject matter experts, tel community, or IT system, senior leadership, or student representatives. So we have been all part of this journey. So sooner we have everyone on board, then we have a better ratio of success. I would say now, if my tip is that just be aware of, as Abby mentioned, logistical issues of delivering this. So probably if we could go back, I mean, probably we would have started on a smaller scale, and we would have given us longer time to develop this. But I remember I joined Abbey Kings in I think February 2024, and we had to deliver it in July. So I mean that's 6 months, and I was like but thanks to the fact that Abby and I will work very well together, so we managed to do it. But probably if we had the wider faculty, especially the IT committee sooner on board, probably we could have had an easier start. But that's part of it.
So again, it comes down to early engagement and stakeholders. But it's been absolutely brilliant. And so thank you both so much for joining us today. If people are interested about finding out a little bit more about what you're doing, where can people look to find out more about what you're doing at King's?
So definitely the King's website is a very good place to start. There are a few articles and commentary pieces that are advertised through the King's website that they could have a look at. Benham and I have recently just written, as is Benham, top tips of creating a character, co-designing in AI, which was published by the British Journal of Nursing. So there are a few articles like that we have.
Well, we'll certainly put a link to your article in the description below.
Yeah.
So,
go on, Abby.
What I was going to say, and then the other thing is, please reach out to us, because we're finding that is wonderful. Getting to know the community, which we already know, but more and more of the community getting in touch with us, and thinking about how we then pull all this together in terms of sharing, learning, and experiences. Which, thank you very much to both of you. This is exactly what this platform offers. So anybody that wants to reach out and get in touch with us, we're always delighted to hear from you.
Great, thank you so much. And what a perfect way to end it is, regardless of all of the techniques, the technology involved, it all rests on the community that we have, and what a vibrant simulation community we have across the country.
Yeah.
I guess our job is to try and make sure they're all joined up as much as they can be.
So Benham, Amy, thank you so much for your time today, for sharing your knowledge and your expertise and your experiences of putting this together. It's been great hearing about it.
Thank you for joining us.
Yeah, and thank you for listening to this episode of SimCast. We hope you enjoyed it, and we look forward to speaking to you again on the next one. Bye.
Thanks, everybody. Bye-bye.